Hi, my name is Sierra. I'm the Clinical Application Analyst Trainer. Today we're going to be talking about restraint updates for nursing. If you have any questions or concerns about the presentation, please reach out to me. We've also included Quality's contact information as they were extensively involved in this project. Our objectives are to cover restraint update overview, chemical restraint updates, restraint assessment documentation, and ED face-to-face notification. The purpose of the restraint updates is to increase safety and decrease fallouts. Violent restraints and nonviolent restraints can be documented on the restraint assessment. This can be manually added to the work list by the nurse. Chemical restraints can be documented on the RN chemical restraint assessment. This will flow to the work list by order. Violent and nonviolent restraints will continue to be series orders. Chemical restraints is a one-time order. The face-to-face notification will generate when violent or chemical restraints are initiated or renewed. Our big ask is to have nurses document the restraints within 10 minutes of initiating said restraints, preferably within 5 minutes. If the nurse is unable to chart the restraints in less than 10 minutes, we ask that you please make a chart note explaining why. This will help quality judge whether a fallout has occurred. Additionally, we'd also like the nurse to call the provider to notify them of the time that the restraints were initiated for violent restraints. This is because the face-to-face notification is generated off of nursing charting the restraint assessment. If the nurse is charting it late, the face-to-face notification to the provider will be late as well, so they won't have an accurate time frame. When the provider orders a chemical restraint, two things are going to happen. The first is that the RN chemical restraint assessment will flow to the work list. Let's take a look at the chemical restraint assessment. Very similar to the restraint assessment with some very minor differences. The first is that the chemical restraint should be done Q15, Q30, and Q2 hour for the vital signs. There are options to initiate and monitor chemical restraints. If you select initiate, a send face-to-face reminder will automatically be selected. Additionally, we've added a question, was physical hold used during chemical restraint medication administration? And you can indicate yes or no. Here you can fill out the vital signs for your chemical restraint. There's also an option for tele if tele was placed on the patient. The other thing that will happen is that your medication that was ordered for chemical restraint will say ordered for chemical restraint under label comments.
For your violent and nonviolent restraints, you are going to need to go to Add. You'll search Restraint, and you'll add your restraint assessment this way. It's grayed out because it's already been added to our work list. So we're going to go ahead and document our restraint assessment. So based off of our input from our restraint status and our restraint type, our expiration date and time will be populated. So if I were to select initiate or renew a violent or a chemical, it's going to automatically select an expiration date and time. And this is done per protocol. So the patient's age is taken into account and it sets the expiration date appropriately. Another thing that happens is if it's a initiate or renew a violent or a chemical, it will automatically send a face-to-face reminder to your provider. And it's grayed out, so I can't change it. It's automatically defaulted. Speaking of the age and the frequency of your restraints, you can always go to your protocol, physician order requirements. So 4 hours for patients ages 18 and older, 2 hours for children and youth ages 9 to 17, and 1 hour for children under age 9. So this is available for you to see in your protocols. So here is a restraint plan of care added, and I'm going to say yes. There will be a pop-up that comes up that says, please add your care plan. Next is this attestation piece. So anytime you renew, monitor, or discontinue, this will be available for you to attest that you've been checking on the patient every 15 minutes. Obviously, it doesn't come up for the initiate because you've just put on restraint, so therefore you haven't been previously checking on your patient. That's why it's grayed out for initiate right now. And we'll just fill out the fields. There is a pause for care, so if you were to pause the restraints, you can chart here that you've paused the restraints. Everything should look relatively the same as it was before. We've just added a couple of things, and we've added some rules, particularly to that restraint status and restraint type at the very beginning. We've also added vital signs, which you can chart here, and telemetry. If I were to chart a discontinue, the discontinue date and time becomes required. So next I want to show you how to pull the expiration date time from a previous charting forward. So you can click on mode, and here I can see the previous expiration date time. You can simply write it out, or you can hit recall and use the green diamonds to pull it in. So I wanted to talk a little bit more about the restraint status. So our initiate is the first time the restraint goes on at the beginning of the restraint episode. Your renew is when your order expires but is renewed by the provider. It's the same restraint episode. If the restraints were not discontinued and it is the same restraint episode, then it would be considered a renew versus an initiate. Monitor is when your restraint needs to be documented for monitoring purposes, because it needs to be documented at certain intervals per the protocol. You should use monitor to chart in between initiate and renew and discontinue. When the restraint has been discontinued, the restraint episode has ended, or the order has been discontinued. It is important that you document the appropriate status. If the status is marked incorrectly, these expiration date and times are going to be incorrect, and it's going to be sending a lot more face-to-face notifications to your providers. So lastly, for our ED nurses, I wanted to show you how the face-to-face notification works for you guys, because there are a couple of extra steps. So I'll click initiate, I'll say a violent restraint. Our expiration date and time is populated. Our face-to-face reminder has populated as well. That's going to be sent off, and we're just going to chart. When I click save and exit, I'm going to be prompted to order the face-to-face. So I'm going to check my box, click OK, select my provider, and select Provider Initiated Protocol. OK. And I'm going to select the one-time face-to-face due in 1 hour and submit. So what this does is it sends it to the provider on their ED tracker board. So I'm going to pull up a provider view so that you can see what their ED tracker board looks like. And this is the test version, so it's going to look a little bit different in live, but they're now going to have this face-to-face column, and when a face-to-face is ordered, it'll have a check mark here for them.
That concludes the Restraint Update training. Again, if you have any questions or concerns about this training, please contact myself for quality. Thank you and have a wonderful day.